Hello, my name is David Jernigan. I'm a professor in the Department of Health Law, Policy, and Management at the Boston University School of Public Health. I worked on alcohol policy issues since 1986 at every level imaginable, local, state, national, and global. Work as an advisor to the World Health Organization, the International Agency for Research on Cancer, and I've worked with the World Bank on these issues. I'm here today to talk to you about alcohol taxes from the public health perspective. Apologies if I'm covering ground that many of you already know, but this is, to the best of my ability, a summary of what we know about these things from a national and global perspective. So let's start just nationally. Alcohol is our favorite drug. It kills about 500 people a day in the US, including close to 3,000 people a year in Oregon. It is still the #1 drug among young people and adults, related to more than 200 disease and injury conditions in the human body, including 7 cancers. It's also a major cause of social inequities. The same amount of alcohol will cause much greater harm in a poor family, community, or country. And according to one review of the literature, they estimated alcohol causes more than a quarter of all the social inequities in mortality across the board. Quite a remarkable figure. In the US, what's been happening since the turn of the century is alcohol consumption's been rising, whether it's in the past 12 months, high risk drinking up by close to 30%, and DSM-4 defined alcohol use disorders up by almost 50%, with the greatest increases among women, older adults, racial and ethnic minorities, and individuals with lower educational levels and family incomes. This just gives you a sense of that consumption rise. You can see here at the tail end of the curve, this is what's been happening in recent years, quite a sharp increase, particularly during the pandemic. Now, prior to the pandemic, the alcohol-specific death rate since the turn of the century was up by 35%. The rate of emergency room visits per 100,000 population involving alcohol consumption up by almost 50%. And the age-adjusted death rate for alcoholic liver disease, often seen as kind of a canary in the coal mine, up by almost 50%. And then during the pandemic, alcohol-related deaths rose by about 25%. The age-adjusted death rate from alcohol by 25.9%, and the largest increase of that was happening in the 35 to 44-year-old age group. This is a critical age group for our country. This is when people are supposed to be at the peak of their productivity, and this is where we appear to have a pretty serious ongoing alcohol problem. And then what happened during the pandemic? Nearly every state turned alcohol sales essential. They closed many other services, but kept the alcohol outlets open. States also liberalized carry-out cocktails and home delivery, and for the most part have left this in place post the pandemic. And then cities and states also permitted more outdoor dining and alcohol consumption. And this was basically a significant expansion in the availability of alcohol on premise. But all of these are examples of increases in alcohol availability. And given that, it's not surprising that things got worse in terms of alcohol-related harms during the pandemic. So just the big overview again, 178,000 deaths per year in the US, about 1 in 8 deaths among people of working age. And you heard a lot 3 or 4 years ago about what were called the diseases of despair. And what was not heard nearly as much was the role of alcohol in those diseases, with poisoning and overdose, or with alcohol-induced deaths, with suicides, liver cirrhosis deaths, and a really interesting study published in the British Medical Journal. They looked at health claims from 12 million people, mostly across Appalachia, and found that uh, of the health claims that were of these so-called diseases of despair, alcohol was responsible for more than half of those health claims. It was rising the slowest, but that's only because it was starting from the highest level, and it was steadily the biggest cause of the diseases of despair. Now, the last cost study for alcohol we have was way back in 2010. The estimate was at that point it was costing the US economy about $249 billion, approximately $2.05 per drink consumed, with 2 and 5 of those dollars paid directly by government. So that's all the bad news. I'm sure you've heard it over and over again in your task force. What do we do about it? And this is a nice graphic showing the importance of combining both upstream and downstream strategies if we're going to take a comprehensive approach to reducing alcohol problems. Um, Upstream, we want to regulate and control the physical availability. We want to make sure that price and tax keep up with inflation, keep playing their potential preventive role. We want to regulate alcohol promotion to the extent we can. There's stronger and stronger evidence that alcohol promotions actually play a causal role in young people's decisions around drinking. We want to do things in the drinking context, training servers, using plastic rather than glass serviceware to reduce the likelihood of injury, things like that. Of course, we want to keep the drink driving countermeasures in place. We want treatment and early intervention services, and we need to keep up our work to educate the public. We have a horrendous warning label on alcoholic beverages and no warnings on ads, unlike many other countries around the world. We've learned nothing from tobacco in terms of how we warn the population about use of alcohol. But warning labels are one of our weaker strategies. It's important, but education and persuasion strategies like that only work well if the things higher up in the stream are also headed in the right direction. So from that perspective, then the Centers for Disease Control has something called the Community Guide. It's done by the Task Force on Community Preventive Services, which is a voluntary, non-federal task force whose job is basically to just do massive literature reviews of the scientific literature over and over again across the board to see at the community level what is most effective. And their recommendations for preventing excessive drinking include increasing alcohol taxes, regulating the density of the alcohol outlets in any given community, keeping commercial hosts liable for damage that drinkers who have drunk in their establishments cause when they leave the establishment, avoiding privatization, keeping the monopolies in place, maintaining limits on days and hours of sale, and enhancing the enforcement of 21. That's what we found effective at the national level. At the global level, the World Health Organization has their own set of researchers who look at this both from the perspective of effectiveness and cost effectiveness. And what they found is actually the most cost-effective and effective strategy is actually alcohol taxes and other price controls. Also effective and cost-effective, regulating physical availability, again, through restrictions on time, place, and density of the outlets, and then regulating alcohol advertising and other marketing. Each additional dollar invested in these yields greater benefits than the tobacco control interventions or physical activity interventions. So a remarkable body of literature showing that there are things we can do that are effective, and leading the list is taxes. So what do we know about alcohol taxes? Well, it's always fun to go back to Adam Smith, the godfather of capitalism, who wrote, "Sugar, rum, and tobacco are commodities which are nowhere necessaries of life, which are become objects of almost universal consumption and which are therefore extremely proper subjects of taxation. Now, this was also Mayor Bloomberg sponsored a global task force on fiscal policies for health in 2019. And that task force concluded if all countries increase their excise taxes to raise prices on tobacco, alcohol, and sugary beverages by 50%, we could prevent over 50 million premature deaths over the next 50 years, while raising more than $20 trillion of additional revenues. Raising taxes and prices further in future years would save additional lives and raise even more revenues. Now, why is this a case? This is basic economics. The theoretical assumption here is increasing the economic cost of alcohol relative to alternative commodities will reduce demand. And that relative to alternative commodities is absolutely critical. The cost of alcohol has to stay sufficiently high relative to alternatives in order for it to play its preventive function. And the way we keep those prices high is we increase taxes, we put in place minimum pricing, a floor beyond which sellers can't discount, banning below cost sales or happy hour drink discounts. And then also some states, a number of jurisdictions around the world have used the tax structure to incentivize lower alcohol products and have also placed special taxes on certain products such as the alcopops, the sweet, fizzy, fruity flavored drinks that are often popular among the youngest drinkers. The evidence in support of this, as I said, it's based on sound economic theory. When we increase the price of a product, demand will decrease. And studies from around the world have shown that increased taxation on alcohol leads to less consumption, fewer alcohol-related deaths, crime, violent assaults, traffic crashes. Minimum pricing, also a very promising strategy. For the taxes, young people and heavy drinkers are not an exception. Taxes on alcopops will reduce consumption among young people, and lower taxes on low alcohol products can lead to product switching. The Community Preventive Services Task Force, CDC's advisory body, reviewed 73 studies, and they estimated based on that review that when the change and when the price of alcohol goes up by 1%, you're going to see a 0.5% drop in consumption of beer, a 0.6%, 4% drop in consumption of wine, and a 0.79% drop in consumption of spirits. They found that the higher prices and taxes were also consistently related to fewer motor vehicle crashes and fatalities, less alcohol-impaired driving overall, less mortality from liver cirrhosis, and less all-cause mortality. Effects were also found for measures of violence, sexually transmitted diseases, and alcohol dependence. Now, that was back in 2010. In 2022, this is the most recent systematic umbrella review where they reviewed the systematic reviews. They found 30 of them, and according to this review of reviews of the literature, again, higher alcohol taxes and prices were consistently related to lower total alcohol consumption. Their elasticity estimates, that is the expected percentage change in alcohol consumption when the price went up, were slightly lower, but still 1% increase could be expected to lead to about a 0.3% drop in beer consumption, 0.6% drop in wine consumption, and a 0.65% drop in spirits consumption. They also found very strong evidence for the effectiveness of alcohol taxes in targeting heavy drinkers and heavy episodic drinking, that is binge drinking. Other reviews have also found specific studies that these increases in these taxes lead to lower rates of liver cirrhosis, delirium tremens, male suicide, criminality, hospitalizations, alcohol-related disease mortality overall, workplace injuries, sexually transmitted diseases, interpersonal violence, rape, robbery, and severe violence towards children. And one study even tried to look at would there be any effect on possible heart benefits among moderate drinkers. While that literature has been largely discredited in recent years, nonetheless, that study found no impact on if those benefits were there, no impact on them from a tax increase. So there's some other very good reasons from an economics perspective to raise alcohol taxes. One of the first of these is fairness, that alcohol taxes do not come anywhere near covering the costs of the additional governmental services used by heavy drinkers. And these costs include medical care, long-term care, criminal justice services. So that one way that alcohol taxes can be viewed is as a user fee or an insurance premium to cover the costs and risks incurred by consumers of alcohol. There's also an economic efficiency argument to be made here in that alcohol taxes help correct for the negative externalities, as economists put it, of alcohol use. The bad things that happen to other people because of the drinkers drinking. And alcohol taxes can also correct for the inefficiency of the marketplace. In the US in particular, alcohol producers are an oligopoly. This is particularly true for beer, but also very true for spirits. And so the producers are able to artificially manage prices. Again, multiple studies of this. And the taxes help correct for that inefficiency, that market flaw. The bottom line with alcohol and free markets is the market cannot correct sufficiently, both for oligopoly and for the harms, the negative externalities. Now, another reason for raising this is revenue needs. And this perhaps slightly overcomplicated graph shows those declines in both federal and state alcohol excise revenues from 1977 to 2008. Now, the blue line is the percent of total revenues paid for by alcohol taxes. And you can see, if you think back, after Prohibition, alcohol taxes were still about 9% of federal revenues. I should say before Prohibition, they were 30% of federal revenues. But if we check into this in about 1987, you can see they're about 1.5% of federal revenues. By 2008, they're down to less than 0.4%. And then the green line is the actual federal alcohol tax revenues, falling consistently over that period of time, with a slight bump for the 1991 Bush 1 era tax increase. And then the gray line, the state alcohol taxes, also declining steadily over time. This shows that even more dramatically. This is inflation adjusted federal beer tax and tax revenues from 1945 to 2013. Again, you can see that Bush 1 era tax increase showing up in 1991. But other than that, a pretty consistent trend of these revenues declining and losing their actual value. And then this is state excise taxes from 1933 to 2018. What seems to have happened in states is that in the early 1970s, 1971, 1972, states stopped increasing their alcohol taxes. Prior to that, the taxes had been pretty much flat, which means that they were being regularly increased to keep up with inflation. But you see a precipitous drop beginning in the early 1970s and continuing to the present day. What does this mean? One of my colleagues calls these state alcohol taxes a poorly performing revenue source. I currently live in Massachusetts, and that's what that looks like in Massachusetts. But if you go to the print on the right, in 2010, alcohol cost Oregon $2.08 per drink, and 88 cents of that was being paid directly by governments in Oregon. And yet, in most states, the actual tax on alcohol is pennies a drink. at this point. Um, from 1991 to 2015, across all 50 states, the average inflation adjusted state alcohol tax rate fell 30% for beer, 32% for distilled spirits, and 27% for wine. Now, contrast that with what we've done with cigarettes. And I don't think anybody can argue that we've had a tremendous public health success in reducing tobacco consumption. We're not done, as my tobacco control colleagues often tell me, but nonetheless, we've taken meaningful steps and really, really reduced cigarette consumption and tobacco-related harm in this country. And part of that has been really dramatic increases in the cigarette taxes. This example is drawn from the state of Texas, and you can see dramatic increases in the cigarette tax and almost no increase in the beer tax over that roughly 80-year period. Going to Oregon, let's talk about who would pay for an alcohol tax. And this is research that my colleagues did using data from the Behavioral Risk Factor Surveillance System, which is CDC's huge 330,000 people per year survey of health behaviors across the board in the US population. And what we find in Oregon is, first of all, 41% of the Oregon population would pay nothing because they're the abstainers. They are paying for the damages of drinkers through other taxes because alcohol, as I said, doesn't pay for itself, but they would pay no additional tax. The non-excessive drinkers, about 39% of the population. And you can see from the chart on the right, they would pay very little. Even a quarter a drink, which would be a huge tax increase, they'd be paying less than $10 additional tax per year. Whereas the excessive drinkers would pay nearly 5 times that. This is exactly what we want to see. These are much more targeted taxes than people often think. Now, people often say, well, these are regressive and that poor people will pay more. But poor people with lower incomes are also much more price sensitive, so that lower income people, and particularly lower income families, will see greater reductions in alcohol use, greater health benefits from those reductions. So in that sense, the health benefits from these tax increases are clearly progressive. Also, the funds from this shift money from a relatively capital intensive area of the economy, which is alcohol production, et cetera, to an incredibly labor intensive part of the economy, which is government and other human services. Poor people use those services much more than wealthier people. So that's another way in which they would benefit more than higher income groups from an increase in an alcohol tax. But there's also just a basic job benefit from these. As I said, they are shifting the spending from relatively capital intensive to much more labor intensive sectors. So we modeled this for the 50 states. And these are the results for Oregon at various scenarios of an increase in the tax on alcohol. You would see significant job creation. Again, that quarter a drink increase. If you just put the money in the general fund in Oregon, 3,600 jobs created. If it went to healthcare, slightly more capital intensive, about 1,700 jobs. Now, our public health goals here in terms of alcohol taxes, we prefer that alcohol be taxed based on its alcohol content, but it absolutely needs to be indexed for inflation, and there needs to be a minimum price. Does this work in real life? I was part of the effort in Maryland to increase the tax there in 2011. We increased the sales tax by about 3%. It's now raising more than $100 million a year because, of course, sales taxes do rise with inflation. But there have been 3 evaluations. The first one found it led to a 24% drop in gonorrhea cases. Second one, about close to a 4% drop in alcohol sales compared to what they would have been otherwise, and then about a 6% drop in alcohol positive drivers on the Maryland roadways. And yet, this was the state of beer taxes nationwide in 2019. Oregon's beer tax at that point was number 45 out of 50 states. The decade of the last permanent beer tax increase, again, as of 2019. You can see Oregon definitely not one of the darkest colors. It's been decades. The bottom line here is that alcohol taxes are a win-win-win. They can raise revenues that can be devoted to healthcare access and prevention and so on. They can reduce consumption and problems. And every time we poll them, they're popular with the public. And again, it's that simple reason that many people will pay nothing, and most people will pay very little if they're raised sufficiently often so that affordability does not increase. So this is what's critical to having their preventive value. States need to raise them more often. Sometimes there are concerns about the illegal bootleg smuggling. We don't have a big concern about that in the US, but where we do, we find that when we do increase the tax, the price in the illegal market tends to increase as well. So the bottom line here, these are costing about $2.08 per drink. Increases in price reduce consumption and alcohol-related harms. At the federal level alone, there's been a 36% erosion in the federal tax since 1991. The industry argues that the tax hurt the poor and kill jobs, but taxes are much more targeted. The heaviest drinkers will pay the most, and poor drinkers and their families will reap the biggest benefit. The net jobs impact is positive. Now, we had the 2017 federal alcohol tax cut. At the time, it cut federal taxes by about 16%. Brookings Institute estimated that was going to lead to somewhere between 281 and 569 more motor vehicle crash deaths, and an additional about 1,500 alcohol-related deaths. And I should say the Department of the Treasury came out with a report on that tax a couple of years ago. They found that 2/3 of the benefit from that tax went to the biggest companies, despite the fact that it was sold as a tax that was going to protect and encourage small business, craft brewers, and so on. So again, the bottom line, alcohol taxes are an underutilized and underappreciated part of a comprehensive approach to reducing alcohol-related harm. Thanks so much for your attention. I hope this has been a useful contribution to your deliberations.